What was your educational experience like?
Well, you need a bachelor's degree to apply. And then after that, it is ordinarily a 4-year program. When I went, they were trying to graduate more podiatrists, so they made it a 3-year program with no vacation, so it was very time intensive. The first year was primarily the basic sciences all over again, anatomy, physiology, biology, biochemistry, etc. And then from there we moved on to the more specific things like neurology, other basic medical classes. And then when we graduated, we could do an additional year or two called an externship at either a clinic that specialized in podiatric problems or work with another podiatrist. So it was potentially anywhere from a 4 to 6 year program professionally.
And what type of services do you provide?
Again, that varies tremendously. When I first started in my career, I was working more with children and young adults. Children might have deformities like clubfoot or things like that, or certain types, what was called metatarsus adductus, where the toes would be turned a certain way, and what you'd have to do is place them in casts and slowly stretch out the soft tissue so that they would end up with a normal foot. In young adults or adults, I would see a lot of sports-related injuries, shin splints, ankle sprains, things that I would treat, sometimes with the use of orthotics, which were a custom-made type of arch that was placed in the shoe to help balance the foot appropriately. Now I deal primarily in the geriatric realm in nursing facilities where the primary problem is a lack of circulation as individuals get older, and so they're susceptible to things like diabetic ulcers that don't heal, non-healing ulcers, and other situations which may require more dramatic types of surgical intervention.
And what risks or liabilities do you have with your profession?
Primarily it's related to the surgical end of the spectrum. And so that, for example, if anybody who's going to have any type of surgery, maybe something relatively minor, but you have consent forms and you tell them that there are always risks associated with that. Risks of anesthesia, either general or local anesthesia, risks of infection associated with the surgery, where you may have to go in and redo some things. Possibility that the problem, for some types of problems, that they can actually recur even after you've done the surgery, or simply a poor result, expectation on either your part or the part of the patient as to the quality of the result. And so those are always going to be risk factors that one has to deal with.
Thank you for your time, Dr. Eggold.
You're welcome.